Welcome to the Duty to Provide Care online education module. This online education module is based on our practice support tool, Duty to Provide Care Practice Guideline, located on our website. This online education module will discuss the NSCN mandate, the duty to provide care in general and in other situations, your accountabilities and your employer's role in providing care in emergencies, dangerous situations, and unfamiliar practice settings, refusing or withdrawing from care, and in this section we will review lack of competence, abusive situations, moral or ethical conflicts, and fitness to practice concerns. As well, we will also review your accountabilities as a nurse and the shared role for nurses and their employer. The module will conclude with key points. As you can see based on this overview, this module will provide in-depth information for nurses in all practice settings about the duty to provide care. The Nova Scotia College of Nursing mandate is to serve and protect the public interest, preserve the integrity of the nursing profession, maintain public confidence in the ability of the nursing profession to regulate itself, and to set and monitor standards for the profession. There are approximately 14,000 nurses registered with NSCN that provide nursing services to Nova Scotians. This includes licensed practical nurses, registered nurses, and nurse practitioners. The duty to provide care is a nurse's ethical, legal, and professional obligation to provide clients with safe, competent, compassionate, and ethical nursing services. This duty applies to every aspect of the nurse-client relationship. It begins once the relationship is established and client assignment is accepted. The duty persists until the accountability for care has been transferred to another appropriate care provider. An unreasonable burden may exist in rare situations where the nurse is unable to provide care and meet their professional standards of practice because of unreasonable expectations, lack of resources, or ongoing threats to personal safety. An unreasonable burden may exist when a nurse is asked to provide care in an emergency or dangerous situation. This module will provide further information in the upcoming slides on these scenarios and the accountabilities of the nurse and the employer. Emergency situations can vary in nature. For instance, a disease outbreak is considered a public health emergency, or a mass infrastructure failure such as a building collapse, plane crash, act of terrorism, or weather-related disasters are considered emergency situations. Regardless of the type of emergency, your accountabilities are similar. Nurses' accountabilities include your obligation to provide care as needed during a public health or other emergency. While there is a public expectation that nurses assume a certain level of risk during these situations, you are not expected to place yourself unnecessarily in harm's way. You are responsible to use appropriate safety precautions, as outlined by your employer, to minimize your risk. Be aware of relevant pandemic or disaster legislation and your employer's guidelines. Make sure you know where and how to access any available supports and use them as necessary. If these supports do not exist in your work environment, work with your manager to develop them proactively. Employers have a role in providing care in emergency situations, and this includes they are responsible for adequate staffing and resources, and that personnel have the necessary competencies to provide safe care for clients during an emergency. Additionally, employers are obligated to protect and support their employees by ensuring their staff have adequate access to the appropriate protective equipment and supplies. A dangerous situation outside of a disaster is one where the physical safety of the nurse is at high or immediate risk. This can include, but is not limited to, physical, sexual, or emotional abuse from a client or family member, or caring for clients' environments prone to violence, such as homes with weapons in plain sight or aggressive animals. Nurses are obligated to balance their own personal safety with clients' needs. While you are not expected to place yourself at risk, there may be situations where failing to provide care to a client poses a greater risk to them than it does to you to provide the care. For example, this may be the case for a client who has experienced a neurological event resulting in significant personality changes and forceful combative behavior. While there is risk to provide direct physical care, there is a greater risk to the client if subtle changes in the neurological assessment are missed. In this case, you're obligated to work with your employer to implement strategies to minimize your risk while meeting the client's needs. Nurses are also accountable to perform ongoing assessments of your risk when providing care in dangerous situations. This includes documenting your assessment findings, working closely with the client's healthcare team and your manager to ensure everyone is aware of the circumstances and what is being done to support the client and the staff caring for them, and notifying the client's physician or nurse practitioner if care or interventions cannot be carried out as prescribed. Nurses provide care in a variety of places in an infinite number of situations. While it is important that your employer has a plan to minimize actual and potential risks, the nature of nursing is such that unplanned or unintentional risks show up every day. You and your employer share the responsibility for addressing and managing these risks once known. Sometimes this means developing, evaluating, and revising a plan on a day-by-day basis. Under the Occupational Health and Safety Act, employers are obligated to provide a safe work environment, which includes providing a comprehensive program to eliminate or manage the risk of abuse or injury in the workplace. Employers are obligated to develop tools and resources that employees can use under the Occupational Health Act to minimize personal risk and risk to others. While it is important that employers have a plan to minimize actual and potential risks, as we noted in the previous slide, the nature of nursing is such that unplanned or unintentional risks show up every day. Employers and nurses share the responsibility for addressing and managing these risks once known. Refusing to provide care or withdrawing from care may be appropriate in very specific circumstances, and only after full consideration of the impact to the client and after several other strategies have been implemented without success to improve the situation. It is important to note that regardless of the validity of doing so, except in extreme circumstances, you remain accountable to provide care until it has been transferred and accepted by another appropriate care provider. Circumstances for refusing to provide care may include lack of competence, abusive situations, moral or ethical conflicts, or fitness to practice concerns. The upcoming slides will break down each of these circumstances in further detail. The first circumstance for potentially refusing to provide care is due to a lack of competence. These are circumstances where a nurse has not performed an intervention, and performing the intervention places the client at higher risk than not performing it. When a nurse experiences a lack of competence, they have an accountability to work with their manager and employer to rectify this situation. Nurses are accountable to notify their manager immediately and make arrangements to obtain the necessary competence to safely perform the care. This can be attained by one-on-one on-the-job mentoring, reviewing policy or other reference material, and transferring the client to a care provider who can perform the intervention. If this is not possible, notify the appropriate provider for further instruction. Refusing to provide care is only legitimate in very specific circumstances. When legitimate, it always requires the nurse to take immediate follow-up action to ensure the client needs are met. Failure to take reasonable follow-up action may be a violation of your standards of practice. Being busy is rarely a legitimate reason to refuse care, other than in situations where it is not possible, such as managing a client or unit crisis. Nurses should negotiate their workflow with their managers. Refusing to perform a priority task or address a priority client issue because you're busy with other non-priority issues, especially if you have not put strategies in place to manage these, may be a violation of your standards of practice. Your employer has a role that includes being obligated to support you to gain the competence, providing necessary resources, and facilitating a conversation with the appropriate provider or reassigning care. The next circumstance for potentially refusing to provide care is due to abusive situations. These are situations where clients or family members fail to respect the professional relationship, try to control, manipulate, or make you afraid of them. Nurses have the accountability to set boundaries with the client or family when and where doing so will not make the situation worse. They also have the accountability to take action to protect the client by notifying any external agencies such as law enforcement, family services, and adult protective services as necessary. Notify the client or family of your intent to withdraw services when alternative client care is arranged, unless doing so will inflame the situation. Additionally, notify your manager and the appropriate prescriber and document your assessment and actions. In extreme situations, remove yourself immediately from the setting. Protect the client by notifying any external agencies, such as noted above, law enforcement, family services, and adult protective services, as necessary. Notify your manager and the client's primary care provider when you are safe to do so, and document your assessment and actions as we have previously spoken. Employers have the responsibility to support you and others, facilitate conversations with prescribers and other team members, and comply with external agency requirements as needed. While withdrawing from care may be appropriate, it is generally not a decision to be taken lightly. Consider the following as you work towards a decision: the risk to the client if you withdraw from care, the benefit of the care in relation to your risk, what resources can be put in place to reduce your risk, the impact the situation may have on your physical, psychological, and emotional health, and if it negatively impacts other clients, and also consider seeking assistance from a union representative or legal advice from CMPS or your liability insurance provider, Lloyd's SAD. Moral or ethical conflicts are situations where a nurse is unable to provide care in good conscience because elements of client care are in direct opposition to their beliefs or values. In situations where nurses find themselves in moral or ethical conflicts, it is prudent to be knowledgeable of your accountabilities. Notify your manager immediately of your moral or ethical conflict, request assignment change or do your best to arrange for an alternative care provider, and maintain a respectful and professional demeanor with your client until you are replaced. Your employer's role in this situation is to support you within their policy, procedures, guidelines, and directives, and assist in arranging for suitable replacement staff as necessary. Consider that your employer may or may not be able to accommodate your request. You are accountable to provide safe, competent, ethical, and compassionate nursing services until you transfer the accountability for care to an appropriate care provider. The final circumstance for potentially refusing to provide care is fitness to practice concerns. Fitness to practice concerns are situations where a nurse lacks the necessary physical, mental, or emotional ability to provide safe and competent care. If you believe that you lack the necessary physical, mental, or emotional ability to provide safe and competent care, be knowledgeable of your accountabilities to address these. Conduct ongoing self-assessments of your fitness to practice, and if you identify gaps in your ability to practice safely and competently, notify your employer immediately. Remove yourself from the care of the client and take action to address the underlying issue. You will want to work with your employer to arrange for an alternative care provider. Fitness to practice issues may be related to complex issues such as physical or mental illness, or may be intermittent and sporadic such as fatigue. Either way, you are accountable to seek assistance to address the underlying issue and to balance your work and professional life and manage fatigue so you can fulfill your employment contract. Employers have a role to support you within their policy, procedures, guidelines, and directives and assist in arranging for suitable replacement as necessary. Generally, nurses are hired by an employer and not by a specific unit or practice setting, and therefore there may be times when you are temporarily reassigned to an unfamiliar practice setting. This is often called floating, and it is a legitimate employer practice to ensure they can meet the needs of the clients they serve. Nurses' accountabilities include negotiating your assignment, ask for a brief orientation to the area, ask for support from the nurses and other care providers who are familiar with the client population, and clearly communicate with staff what is within your individual scope of practice and what is not. Employers have a responsibility to provide adequate staffing and resources and to ensure that staff are supported to work within their role, scope of practice, and level of competence. As part of meeting their standards of practice, nurse managers and administrators are accountable for appropriate staffing and resources that support nurses to provide safe and competent client care. Abandonment occurs when a nurse fails to meet their duty to provide care, or inappropriately discontinues the nurse-client relationship, or fails to properly transfer the accountability for ongoing care to an appropriate care provider. To prevent abandonment, the following general principles apply. Care must be provided as prescribed and required. If you are unable to provide this care, you must arrange for a suitable replacement, and you are accountable to provide care until this replacement is found. Accountability of care must be transferred to a care provider willing and professionally able to provide safe care. Employers must be given reasonable time to find a suitable replacement or make alternative arrangements. What is reasonable will vary from situation to situation. However, you are obligated to work with your employer on this matter. You must negotiate a mutually acceptable withdrawal from care plan with your employer or the client if you are self-employed. For more information on abandonment, we have developed the Abandonment Practice Guideline that can be found on our website. In situations where your ability to provide nursing services are impacted, it is important to determine what resources are available to support your practice to ensure clients receive safe care. Resources are the tools that enable you to provide safe and competent care. Some are external and are provided by your employer, and others are internal and relate to your individual competence and capacity. Consider these points. Engage your employer for support to access required information or education that contributes to your continued competence. Take action such as engage your employer or seek self-directed learning to address any knowledge gaps. Recognize the difference between being busy and a situation that is enhancing the risk to clients. Notify your manager if you are concerned that a resource gap is or may negatively affect client outcomes. Be able to articulate how the gap is impacting your ability to meet your standards of practice and provide safe care to clients. Be prepared to offer solutions and strategies to address the immediate and long-term need. Offer to participate on committees or working groups responsible for developing policy, processes, guidelines, or directives to address short and long-term resource issues. And finally, recognize and take action such as prioritizing client needs, deferring non-essential client care, accessing personnel from other care areas, or working with your employer to temporarily divert or delay client flow to ensure the delivery of safe care in situations where resources are limited or there is a disagreement about what constitutes enough resources. To conclude this module, we will leave you with some key points. All nurses have an ethical, legal, and professional duty to provide safe, competent, compassionate, and ethical care. Nurses and employers both have a unique shared role. The duty to provide care begins when a client assignment is accepted, which initiates the nurse-client relationship. Refusal to provide care or withdraw from care requires careful and deliberate decision-making and thoughtful consideration of many factors. The duty to provide care persists until the accountability for care is transferred to another appropriate care provider. And finally, nurses must take immediate action if they self-assess that they lack the necessary fitness to practice nursing. Thank you for participating in this online education module. We encourage you to reach out to the practice team should you have any questions.